There's some new research out today that's shown a link between hearing loss and your chances of developing dementia later in life. So I'm afraid this news story isn't getting much better for me or possibly for you either. Professor Henry Brodaty is the co-director of the Centre for Healthy Brain Ageing at the University of New South Wales. He was involved in the study and joins me on ABC Newcastle. Henry, good afternoon.
Good afternoon, Paul.
It's a long study, 6 years. Gee, you've put a lot of work into this.
Well, it's even longer. We've been going for about 14 years. We've just analysed the 6-year data on this, and we'll be going further, looking at the longer data as well.
So why are these results so groundbreaking?
Well, first of all, it's a population-based study. We recruited people from the electoral roll in southeast Sydney, over 1,000 people aged 70 to 90. And we interviewed them in a lot of detail and did some very detailed cognitive testing. That's testing their memory, their speed of information processing, the ability to understand things, and so forth. And we also asked them about their hearing, and they could say they had no problems or mild problems, or problems picking up on conversations, or severe hearing loss. So the last two were moderate to severe. And we tested them every 2 years, and they're very kind to us, these people. And we found that people who had moderate to severe hearing loss had worse cognition at the first time we tested them. And if we compared them to the people with no hearing loss or mild hearing loss. And but more importantly, when we followed them up over the 6 years, the people with moderate to severe hearing loss declined about 60% more than the people with no hearing loss or mild hearing loss. And we were able to categorize people whether they had dementia. No one had dementia at baseline, but at 6 years, quite a few had something called mild cognitive impairment, which is a precursor to dementia, and some had dementia. So the number of people who had mild cognitive impairment or dementia was significantly greater in the hearing loss group than the no hearing loss group.
What's the connection between hearing and dementia? What does biology and human physiology teach us? Is it the same part of the brain?
No, it's probably not the brain, actually. It's the ears. And so it's not sensory neural, which is the brain pathways. It's thought to be to do with the peripheral ears. Now, what the mechanism is unclear. What's been conjectured is that it may be that people who have hearing loss become less sociable, and we know that people who socialize more, have bigger networks, have more contact with people and more activities with people, have less dementia. So socialization could be a protective effect. But that's unlikely to be the whole story. It may be a small part of the story. And just because there's an association doesn't mean it's a cause. And I just want your listeners, of course everyone's listening because they're on the radio, but even with bad hearing, to be assured just because there's an increased risk doesn't mean that a person will get it if they have dementia.
Yeah, okay.
So just putting it in context, if the risk for dementia in your 70s is, say, 10%, then having a 60% increase means it'll be 16%. So the risk is increased, but it's quite large, but the absolute increase is small. And the good news is there are studies coming out now that people who wear hearing aids actually can reduce that risk.
Actually, the social connection one is a really interesting one because my younger sister, has 2 cochlear implants. She was, mum had German measles when she was a fetus, and she has serious hearing loss, obviously. And she used to avoid social interaction for that reason, because particularly in a crowded environment, it's impossible to hear anything.
Yes, exactly.
And so if she's deprived of some of that stimulus, it reinforces what you said a bit earlier, of course. So is there a message in that? What are the kinds of things that people who are having hearing problems, what can they do? Is there anything that we know from this study that they can do to try and delay the onset of dementia?
Yes, well, first of all, don't be alarmed. So be alert but not alarmed, as they say. And if wearing a hearing aid is a good idea, and the earlier you wear a hearing aid, the better, because people in late life are much less likely to, most of those hearing aids end up in drawers rather than in their ears. The second thing is there are many other things we can do to prevent dementia. We can exercise regularly. We can keep using our brain and keep stimulating our brain. We can socialise, as I mentioned. We can eat a healthy diet, which is mainly the Mediterranean type diet, which is very plant-based. We can make sure that our blood pressure is under control. And if we have diabetes, we have that treated. And if we're obese, we avoid that in midlife because that can be a risk factor. So there are quite a few things that we can do to reduce the risk or delay the onset, at least, of dementia. And for older people, and I'm one of them, what we fear most used to be cancer, but now people in all the surveys say dementia.
Yeah, no, it's terrifying for many people I know. Henry, thank you so much for giving us a greater insight.
All right. Okay. Thanks. Bye-bye.
Professor Henry Brodaty is the co-director of the Centre for Healthy Brain Ageing at the University of New South Wales.